Well, normally when somebody needs a sleep study, they would have come in and either seen us in our clinic or another physician would have recommended it. And in normal circumstances, it's one night in the clinical sleep laboratory. And that one night, what we're trying to do is, as close as possible, have the patient sleep in their normal pattern so that we get a good sampling of what their sleeping is like. One thing that's kind of neat about the sleep study is once you go to sleep, you can't fake what your patterns are going to be because they're all, to some degree, automatic and involuntary. So the sleep study is very accurate because you can't fake the results. But the process they go through is when you come in the evening after dinner, there are tape sensors that go on your skin. A typical sleep study is just all tape sensors on your skin, and there's nothing that's invasive and there's no needles involved. But you have brainwave sensors to detect the brain waves, eye movement sensors to know when you're having rapid eye movements, which is what dreaming sleep is. And you also need muscle electrodes. And the reason you have the muscle electrodes is to find out how much muscle tone is there. Because one interesting part of dreaming sleep is that you essentially have loss of muscle tone in most of your muscles. But we also keep track of breathing, heart rate, oxygen, and effort at breathing. So there's a bunch of different tape sensors on the patient. But usually people who come into the sleep center have sleep problems, and they don't have too much trouble sleeping even with the sensors on. So we get very good information, and that's what we analyze to diagnose people and decide, what kind of treatment do they need for either sleep apnea if they're not breathing well, leg kicking problems if that's their issue, or whatever their sleep disorder might be.